Diabetes is a chronic metabolic disease whose prevalence, the number of cases in the population, is constantly increasing, particularly as the population is aging. We estimate that more than 500 million of people are affected by diabetes worldwide, and type 2 diabetes represents almost 95%. In fact, 1 in 10 adults are concerned. Diabetes is characterized by elevated levels of blood sugar, also called hyperglycemia, which leads over time to serious complications. Beyond known complications of type 2 diabetes such as stroke, eye disorders, cardiovascular disease, nephropathy, neurological disorder, and even foot damage, we now know that type 2 diabetes have a deleterious effect on bone, leading to bone fragility. In fact, patients with type 2 diabetes have an increased risk of fractures, almost twofold. My project aimed to better understand this problematic of bone fragility in type 2 diabetes, with a focus on osteocytes and mechanotransduction, the perception and response to mechanical stimuli. If we take a look into a healthy bone, there is a balance between the degradation of bone by osteoclasts, the bone-eating cells, and the formation of bone by osteoblasts, the bone-producing cells, and this process is called bone metabolism and is orchestrated by the cells underneath the surface, the osteocytes. When there is a mechanical stimulation on osteocytes, during exercising for example, this will block SOST, a negative regulator of bone formation, and allow the bone-producing cells to form new bone. On the other side, in the absence of mechanical stimulation, osteocyte will produce more rank ligand and less OPG to activate the degradation of bone by osteoclasts. We hypothesize that type 2 diabetes impacts osteocyte function, and we aim to characterize the effect on the bone response to exercise and therefore bone quality not to be altered in type 2 diabetes. To investigate this hypothesis, we use preclinical mouse models of type 2 diabetes that we compare to healthy mice. With the technology available in our lab, we are able to assess bone structure, microarchitecture, and even bone strength. We are also capable of measuring the variations of gene expression in bones at the molecular level. In addition to animal models, we use bone cell lines to investigate the effect of different components such as glucose and insulin on the activity, the morphology, and the function of these cells. Within FIDELIO, we all collaborate to unravel the complexity of bone fragility in diabetes, and we aim to improve bone health in diabetic patients.